Welcome everyone to today's virtual policy forum, the future of healthy schools, supportive funding, systems change, and community collaboration. We're so glad that you could join us for this timely conversation. To start, we'd like to take a moment and ask you to please pull out your phones and participate in an opening poll. To participate in the poll, please register by texting Health Policy 261 to 22333 or by visiting pollev.com/Health Policy 261. The information is also available on the screen. Our first question of the day gives us a sense of who is in the audience. So our first question is, what role or roles do you play in supporting healthy schools? Are you an educator, parent, researcher, etc.? This might be a professional, personal, or even a volunteer type of capacity. So if you pull out your phones and participate in the poll, we'll take a look at what the findings show. Researcher, great. Others, let's see. Again, Health Policy 261 to 22333. Here we go. Educator, health, school, teacher, attendance, reproductive, student, great. Advocate, wonderful. Provider, social, funder, coordinator, district, great. Trainer, wonderful. Thank you all for participating in this poll. Now we all have a sense of folks that are joining us today. It looks like a pretty diverse group of folks that are joining us. So thank you for attending. So I'm Cecilia Oregón. I'm the Executive Director of Kaiser Permanente's Institute for Health Policy. At the Institute, we host events and publish information to shape policy and practice on important health topics. We often convene experts to share knowledge, spark discourse, advance collective thinking, and explore opportunities to cultivate healthy communities and promote more accessible, high-quality healthcare. I'm very interested in how the places we live, work, and play shape the health of our communities, and I'm pleased to facilitate today's conversation with leaders who are working to shape the future of our schools, a place that's the foundation for building healthy lives. A few quick housekeeping tips. After some introductory remarks from our speakers, we'll take questions from the audience. You can submit questions through the Ask a Question box on your screen at any point during the forum. If you're on a large screen, it'll be on the right of the main screen. On a smaller screen, it'll be right below. And we'll also pull questions from those that were submitted during the registration before the event. We'll likely won't have time to get to every question, but we'll do our best to ask as many as possible. And if at any time you experience technical difficulties, please submit a question to the host through the Ask a Question box. This event is being recorded and the video will be made available on the Institute for Health Policy's website within the next few weeks. On to our content for today. In this conversation, we'll be discussing the unique opportunity that we have at this stage of the pandemic to fully integrate schools and health. Before we jump to the future, let's pause for a moment to think about how this is truer today than ever before. By the end of March 2020, school operations nationwide had either been suspended or shifted to distance or virtual learning. This caused widespread disruption across the country as families, teachers, and school leaders responded quickly to continue educating America's youth. In the aftermath, a renewed focus has emerged on the health and well-being of children and their teachers as we saw mental health issues rise, physical activity fall, and the social safety net pulled out from under more and more families. Congress responded with 3 stimulus bills that provided over $190 billion for education. The funding to state education agencies and local education agencies represents a historic opportunity to support student and staff health and wellness. Fortunately, Kaiser Permanente's Thriving Schools team engaged closely with the National School Health Collaborative. a collective impact group of well-established, nationally recognized organizations working in the area of health and education. The National School Health Collaborative believes that health is an essential precondition for teaching and learning. The NSHC seeks to transform K-12 education by expanding and innovating policies and practices across all areas of school health and sewing them into a singular national strategic roadmap. The roadmap promotes consistency at its core and flexibility at the local levels and is intended for policymakers and educators at the federal, state, and local level. So we can envision a future that centers health and education, and we will dive into ways to fund and support that goal today. We'll have a group conversation about these issues with 3 esteemed panelists. But to set the stage, we'd like to turn now to a new report from Child Trends. This report maps out how the U.S. federal government currently defines, funds, supports, inhibits, and holds accountable school health programs. I'm pleased to introduce the lead researcher of this report, Dr. Deborah Temkin. Dr. Temkin is the Vice President for Youth Development and Education Research at Child Trends, where she aims to use quality research to inform policy and practice and improve conditions for learning so that all students can thrive. Dr. Temkin co-leads the Policy Analysis and Development arm of the Robert Wood Johnson Foundation's Together for Healthy and Successful Schools initiative, which aims to document and inform state policies across all components of the CDC's Whole School, Whole Community, Whole Child Framework, or WISC. Now, Dr. Temkin.
Thank you so much for that kind introduction. And I'm very excited to speak with all of you today about our new Child Trends and Kaiser Permanente report about the current landscape of federal efforts around K-12 school health. Before digging into that report, I want to start with a bit of background about why we undertook this project and our goals for the work. As you just heard, we are at a watershed moment where more and more the importance of schools in promoting student and school staff's mental and physical well-being is being recognized. But yet, the systems, policies, and practices are still far away from where they need to be to promote truly healthy schools. Next slide. We know that health is foundational for students to learn and for teachers to effectively teach. And yet health has never been a central focus to how we think about improving schools or focusing on combating the many inequities we see across the education system. Under-resourced and systematically disadvantaged communities, including communities of color and low-income communities, face barriers in accessing healthcare and other basic needs, which directly impacts their experiences with the education system. But doing so requires first an understanding of what we mean by school health or healthy schools, and second, an understanding of where we currently are in efforts to bridge the two fields. Next slide. I want to start first with how I tend to think about and define school health and the foundation for the work I will share today. The Whole School, Whole Community, Whole Child Framework, or WISC, was developed by the Centers for Disease Control and Prevention and ASCD as an extension of the original comprehensive school health model to showcase 10 key supports students need in school that create the conditions for students to be healthy, safe, challenged, supported, and engaged, and ultimately, at its core, to learn. Under this model, school health is not just about physical health needs. Instead, it highlights that students' health is inseparable from their mental and social health. Moreover, it showcases that school climate, family engagement, community involvement, and importantly, the health of school staff are all integral to the health of students. So again, to reiterate, when we talk about school health, we don't just mean health services or health education and physical education. We truly mean all of the supports, from social emotional learning to school discipline policies to air quality, that form the conditions for learning. But the framework is truly that, a vision of what school health should be, with all of the elements working together, building off one another in a coordinated way. The question remains, though, whether and how this actually plays out in schools. Next slide. To start to answer that question, along with colleagues from the University of Illinois at Chicago, EMT Associates, and the National Association of State Boards of Education, and with support from the Robert Wood Johnson Foundation, Child Trends conducted a landscape analysis of state statutes and regulations, as well as non-codified policies across 200 topics related to school health. You can find all of these data housed on the NASB State Policy Database on School Health. The good news is that every state has at least some policies that target school health in some way. The more complicated news is that largely these policies are not coordinated, and the 10 domains of the WISC are addressed to varying degrees across the states. Employee wellness, for example, is hardly covered in state laws. And as you can see by the map shown on the slide, there is substantial variation across states in the number of topics covered, ranging from 22% to nearly 80%. Next slide. We found similar patterns in a follow-up study of around 400 school district policies, randomly sampled from 20 states shown here. Generally, as would be expected, there were large correlations between having state laws on a topic and having a district policy, but not always. Again, though, we saw substantial variation in the degree to which topics were coordinated across the WISC. The upshot of the story within both our state and district analyses is that it is clear that certain elements of school health have become more integrated into education policy than others, but this is far from consistent across everything we consider to be critical for the well-being of student and staff. Next slide. We have a clear picture of the current landscape of policies at the state and district level, but we did not, to this point, have a clear map of federal efforts, which leads me to our new analysis. I think it's important to note that unlike the states and district level, where policies are often much more directive and prescriptive, this is largely not the role of the federal government. The federal government instead uses the power of the purse to help guide states, districts, and schools towards policy priorities, but typically cannot mandate, for example, that every school adopt any specific type of policy or curriculum. State law or district policy, on the other hand, can, for example, mandate that every school implements a health education standard or bans the use of suspension among elementary school students. The federal government can also put out guidance or technical assistance based on research to help inform practice, but again, typically cannot tell states, districts, or schools precisely what to do. There's some nuance to this, of course, but it's important to understand the difference between how the federal government supports school health versus state and local governments, as we dig deeper into what school health looks like at the federal level. The federal government is also both an influencer and a reflection of what is happening in states and at the school and district level. Schools are often grounds for experimentation that lead up to the guidance produced by the federal government. Next slide. For this analysis, we asked 3 key questions. First, what federal agencies support school health initiatives and how do they work together? Second, how do federal school health efforts advance the WISC? And third, how do federal school health efforts focus on groups that have faced systemic barriers in health and education? Next slide. We considered 4 primary sources of federal supports. First, formal interagency collaborations or working groups that consist of multiple federal agencies working together around a common topic. Second, formula grant programs, which tend to be large federal initiatives where money flows to states in a systematic way to fund things like Medicaid or Medicare. Third, discretionary grant programs, which tend to be competitive grant programs that states, districts, or schools can apply for. And finally, technical assistance efforts, which tend to be guidance or formal centers that the government produces. Next slide. To conduct our analysis, we conducted systematic searches of 3 primary sources: the Federal Register, which publishes notices from across the government, grants.gov, which publishes notices of grant availability, and GovTribe, which is a fee-based service that collates federal documents, including funding announcements. This chart notes the resources we searched through. We included efforts between 2010 and 2020, for any grant program or initiative that repeated over time, we kept only the latest iteration of that program. Next slide. So what did we find? First, this slide shows the number of discretionary grants identified by agency. Note that we have also further broken down the Department of Health and Human Services into its sub-agency details as well. As you can see here, 2 agencies hold the bulk of the discretionary grants that reference anything having to do with school health. And again, remember that we are considering this broadly according to the WISC model. The Department of Education, or ED, and Health and Human Services, HHS, are the 2 agencies with the most grant programs. The Department of Justice has the third most grant programs at 11. But you'll see beyond these three, several other agencies from across the federal government also fund elements of school health, including the Department of Agriculture, the Environmental Protection Agency, the Department of Labor, and the Federal Communications Commission. Next slide. When we break this down by total discretionary funding, and here we are just considering 2019 and 2020, we see the same big three emerge: the Department of Justice, the Department of Education, and HHS. The important thing to note here, though, is that we are broadly inclusive of grant programs that in any way reference school health topics, even if that was only one of many foci of a grant program. For example, the Department of Education's Education Innovation Research Program in 2020 funded social and emotional learning programs, but also funded STEM programs and teacher professional development. The amount of funding that actually was dedicated to school health is likely much smaller than these numbers suggest. Next slide. So we decided to also look at programs that were much more specifically and exclusively focused on school health topics. And an interesting switch occurs. Again, this is 2019 and 2020, so pre-pandemic. We see that for school health specific funding, the Department of Justice provided more funding and discretionary grants than HHS and Ed combined. These funds largely relate to school safety, and specifically school hardening, both in the form of infrastructure and hiring of school resource officers. This just historically is a reflection of the response to the 2018 Parkland school shooting. But it's particularly notable given the relative amount compared to other more broadly preventative school health efforts. Next slide. When we look at how agencies work together, and I'll note here that this is only based on information we can gather from extant public-facing documents related to formal interagency working groups, we again see the Department of Education, the Department of Justice, and HHS emerge as central to this network. This picture, which is called a sociogram, depicts the relationships between agencies with the size of each agency square, representing how important or central that agency is relative to the others in the network. One important thing to note about the interagency working groups is that there are two primary groups specifically focused on school health, neither of which includes the Department of Justice. You'll also notice in this sociogram that many agencies that focus specifically on the needs of certain groups, including military children represented by the Department of Defense, American Indian and Alaska Native children represented by the Department of Interior, as well as White House initiatives on education excellence for Hispanic students, as well as African American students, are on the more periphery aspects of this network. They are not included in many interagency working groups. Next slide. Switching to which topics federal efforts are focused on, we see that here, for discretionary grants, nearly half include a focus on social and emotional climate, followed closely by counseling, psychological and social services, and the physical environment, which again includes things like physical hardening of a school building. We see much less emphasis on the more traditional school health topics of health services, health education, nutrition, or physical education, and very, very little emphasis on employee wellness. Next slide. Grants can and do focus on multiple topics. So when we map which topics are named together, we see an interesting pattern emerge. Again, here in the sociogram, the size of the square represents the centrality of the topic to the overall network. We see a distinct separation between the more traditional school health topics and the broader topics covered in the WISC. In other words, in federal grant programs, we are not seeing the integrated vision called for by the WISC. Next slide. As I mentioned at the beginning, one of our primary goals in wanting to see more integration of health and education is to specifically address the systemic barriers that lead to many disparate outcomes we see for historically disadvantaged and marginalized groups. So one of our key questions was whether and how federal efforts specifically target groups for attention. Most grant programs do indeed include preference for addressing groups, but do so in often problematic and inconsistent ways. For example, there is no consistent definition of what a low-income family or a high-poverty community means. Department of Education grants often use a catch-all, high-needs, low-intriguing definition, which both allows broad interpretation on the part of potential grantees, but also includes among the definition examples such as high minority schools, implying, for instance, that by virtue of being a high minority school, a school will naturally be low achieving. This is very problematic. Most grant programs use a deficit lens in targeting, implying that communities themselves are at risk, rather than specifically calling out the systemic and historic inequities that have led to the disparities that we see. Next slide. There's a lot more in the report, but in the interest of time, I want to focus on these high-level takeaways. So to emphasize, there is no one lead in federal government for school health. Ed, HHS, and DOJ all play central roles, but they are far from the only key agencies at play. They work together on many interagency groups, but not all. And many interagency groups lack key representation, including DOJ, but also agencies representing the viewpoints of key stakeholder groups. And like we saw in our district and state work, there's little integration across school health topics in grant programs and other efforts. Next slide. Just like our district and state work, we found few efforts, oops, let me go back. Thank you. We found few efforts that are focused on employee wellness, a true gap, especially as we consider the role of vicarious trauma and workforce, where nearly half of Black teachers last year reported intentions to leave the profession. Employee wellness cannot be overlooked, both for its importance in promoting student health, but also in its own right for supporting the whole school community. We must make sure that we are taking care of our school staff. And finally, the extent to which federal efforts reach students who face systemic barriers to health and education are limited and often take a deficit lens. Next slide. So where do we go from here? As I mentioned at the top of this talk, in order for us to know where we need to go, we must know where we are. What our three analyses suggest is that we have a long way to go before the CDC's vision for the WISC is fully realized. There is not coordination among school health domains or the major stakeholders, be it the federal agency or the advocates working on these various topics. We need to make sure we are including the wellness of school staff in these efforts, and above all, we need to center equity as a core driver of this work. We have a long way to go to reach this vision, but I truly believe that we can get there if we build upon what has already been done. Thank you.
Great, thank you, Dr. Temkin. The full report is now available on the Child Trends website. So it's time for our next question for the audience. Please pull out your phones again to participate. To participate in this poll, again, please register by texting Health Policy 261 to 22333 or by visiting pollev.com/Health Policy 261. So our second question is, in a few words, what are your initial thoughts or reactions to the Child Trends report? So we'll watch the screen and see what comes up. So again, in a few words, what are your initial thoughts or reactions to the Child Trends report? Right. Thought-provoking, insightful, school hardening. No surprises. Funding streams are siloed, yes. Work baseline for driving change. Comprehensive. Sobering. Not surprising. Incredible. Not enough spent on health education setting. Room for collaboration, absolutely. Thank you. More collaboration needed. So thank you. You continue to populate the poll. And these are really thoughtful reactions to the content. So Clearly, funding school health in a coordinated and collaborative manner across agencies is not easy, and there's a lot to do. Now we'll shift to a discussion about the future of school health. To start us off, I'll ask each speaker to introduce themselves and provide a brief reflection on the report, what key takeaways, any surprises, or big hopes and concerns. We'll start with Holly Hunt with a federal perspective, then go to Charlene Russell-Tucker with a state perspective, and lastly to Erin Simon at the school administration level. Then I'll guide us through a few additional questions before we turn to audience questions. And if you have a question, please submit it in the box to the right of your screen. So for now, happy to pass this to Holly Hunt.
Thank you, Cecilia. Good morning or good afternoon, whatever the case may be for those of you participating in today's forum. I want to start by first thanking Kaiser Permanente for supporting Child Trans to do this work. This is such a comprehensive, excellent report that I would say we have probably needed for a long time. It will no doubt make a substantial and valuable contribution to the field. Let me introduce myself first. I'm Holly Hunt. I'm Chief of the Healthy Schools Branch in the Division of Population Health in the National Center for Chronic Disease Prevention and Health Promotion at CDC. And I work specifically in a branch that focuses on prevention of chronic disease through school health programs, focused very much on physical activity, healthy eating, management of chronic conditions, and expanding the capacity to provide health services at the district and school level. The WISC model is what we base our programmatic and research application work on. It is our framework for creating healthy environments for students. I want to start by, sharing some of my high-level takeaways because I had quite a few in reading the report. And I want to first say I was struck by the number of funding streams supporting the various WISC components from some of the other federal agencies without a lot of connections or integration with other initiatives. Particularly very surprising was the support from the Department of Justice. Very surprising. We have not had collaborations with DOJ in the past, and clearly there are some opportunities. And what also struck me, which Deb alluded to earlier, was that the results of the federal landscape are not dissimilar to what we find through policies and laws in states and districts. Some doing very siloed work with different components and a lot not really being integrated. But I do think this highlights gaps as well as opportunities we have to leverage the expertise and support within each of our respective federal agencies. And while we do some of that already, we clearly have much more to do. And we are always advocating the need for collaboration at the state and local level. And it appears that we need to do some modeling ourselves in terms of coordinating and collaborating across our own agencies. I was very pleasantly surprised by the number of programs that include social emotional climate as an important component for achieving funding expectations. Unlike most of those that address school-based physical health, such as physical activity and healthy eating, we've been working toward placing more emphasis on the importance of integrating emotional health and physical health, and we're doing that across CDC. We do have a lot more work to do, though, clearly. Was very surprised to see the lack of support to address the physical and emotional health needs of school staff. Again, same situation at the state and district level, but this is a tremendous gap. And now more than ever, it is in such great need of attention. Taking care of our school employees, just as Dr. Temkin said earlier, is absolutely essential to ensuring the health and academic success of our children. And when you think about how much of our communities actually work in schools, it is a pretty significant percentage of our workforce. And as indicated, or as you'll see in the report, a little bit of that work that's being done in emotional well-being for staff is done through CDC, but we are actually expanding our work in this area because we do recognize the importance and need for more expanded programs. And the other key point that I think I'd like to share is that equity continues to be a challenge for us with, as Dr. Temkin said, minimal focus on youth who face systemic barriers, such as poverty, and CDC as a whole and the unit within which I work is very dedicated to prioritizing approaches that will address these barriers and promote equity and address social determinants of health. And certainly in terms of implications through this report, we can do this much more effectively by working together because it is a huge problem and it's not something that one or two federal agencies can do on their own. And I think those were my initial reactions, and I won't take up too much more time because I'm very much looking forward to hearing from an esteemed panelist. And with that, I will turn it over to Ms. Russell-Tucker.
Thank you very much, Holly, and certainly thank you for the invitation to join today's discussion. And kudos, as Holly mentioned, to Kaiser Permanente, the Institute for Health Policy, for facilitating this very timely conversation with an eye towards healthy schools, the examination of funding, systems change, and certainly community collaboration. So by way of background, I am serving as the Commissioner of Education in a recent nomination by our governor on August 19th. I served prior to that in our acting commissioner role. But in my role here at the agency, I have served in many roles within the organization as bureau chief. And so this is interesting background as we talk about my role in this space today, as associate commissioner, as chief operating officer, and as deputy commissioner of educational supports and wellness. And in all these roles, among my portfolio of programs and services, I provided the leadership and oversight to our department's health and related wellness initiatives, including nutrition, physical health, physical education, our school climate issues, initiatives, attendance, school discipline, which really showcase our agency's long-term commitment to the whole child approach when it comes to education. And so addressing the interconnectedness of the social, emotional, physical, and mental health of our students, families, and staff as foundational for positive school and life outcomes, I consider that to be a life's work and passion. So we've been navigating and working to mitigate the impacts of the pandemic on students in our pre-K-12 education system and intentionally addressing the needs of the whole child certainly was a natural response, as it is foundational, as you've heard before. And further, we've heard from the voices of our educators, our families, our communities, and yes, our students. I noticed that student, I think, may be on here on the webinar today, that this was a need. And I quote for you because I think it's important. I pulled this out of a quote from a student who said, "We're all experiencing one trauma together. And instead of just forcing us through it, talk about it with openness. So many students are struggling and so few are saying things. Have people check in on them. Have someone reach out to them. A lot of students need it." So in our state, we've really used the voices of all our key constituents to help us to recognize and understand the need for it. And so this brings me to the Child Trends reports and its timeliness as we in education are considering the impact of the pandemic on learning and how to address recovery, acceleration, all the efforts that we know so critically needed. And so the report and the work, which I hope it will facilitate, holds great promise. As in Connecticut, we've established funding priorities for the federal elementary and secondary school emergency relief funding, and I'm sure we'll talk about that later. But I wanted to share that with you because I think it speaks to the report and where we all need to be. Those priorities include learning acceleration, as I mentioned before, and academic renewal. That's one. Number two, however, is social, emotional, and mental health of students and school staff. So that's where we're saying we're investing, not just at the state level, but at our district level. Certainly the strategic use of technology and staff development in addressing the digital divide. Also key here, number four of our big buckets, family and community connections, which I know is referenced in the report. And finally, building healthy and safe schools. And so what we see from the report is that federal agencies are indeed making significant investments, which are certainly welcomed at the state level. And I'm sure, like the state agencies, our current systems sometimes keep us siloed in our activities and in our actions. And so the scan that was done, I think, sets us up to make sure we can take a look at that, to recognize how we can model. I think Holly might have said modeling at the federal level, as we also model at the state level what it is that we need to do to make sure that we are indeed using the resources or investing the resources in a coordinated fashion amongst not only the federal agencies, but we're having that conversations even across our state agencies as well with some of the resources that we're receiving. So intentional strategic alignment across agencies, critically important. I believe if we're able to do that, that we can ensure sustainability of programming and services that we know bring proven outcomes. So there'll be more conversation to add, but I'll stop there at this point by way of introduction and background. So I think our next speaker then that you'll hear from is Erin.
Thank you so much, Charlene, and again, congratulations on your new position. I am Erin Simon. Hello from Long Beach, California. Let me first begin by saying thank you to Kaiser and also Dr. Temkin for this wonderful report and very timely conversation. The WISC components have indeed opened my eyes, right, to several things. And one is the minimal coordination between health and education agencies, and just the need to incorporate the WISC framework in districts. I am the Assistant Superintendent of School Support Services for the Long Beach Unified School District, where I oversee special education, student support services, which includes social emotional learning, mental health, and many other facets. We are the fourth largest district in California with 85 schools, filled with 69,000 students. Our students will return tomorrow. I'm super excited about that. 63% of our students are socioeconomically disadvantaged, just to give you that piece as well. In my spare time, I also serve as the state president-elect for the Association of California School Administrators, an organization which serves more than 17,000 California educators and advocates for public school students in kindergarten through grade 12, as well as adult learners. And again, it's an honor and pleasure to be with you today. My initial reflection on Dr. Temkin's report, more specifically, what does the report tell me about school health at the district level, is simply, we have some work to do, right, to ensure all of our students and families are well. Our children and staff right now are not well, right? And I think I'm not the only one who has communicated this today or who will not communicate this today. We need wellness support for our teachers and staff so that they can instruct and work with our students fully. My points today are really going to be centered around just the mental health and social emotional well-being aspects really of my work, and work that I see is also just hugely important in what we're discussing today. That said, the report underscored my personal belief that health, which encompasses mental health and social emotional health, are great equalizers. When health is addressed and acted on early, students, no matter their zip code or social status, have an opportunity to thrive personally and also academically. We also know that school sites are the prime locations, right, to serve students in these capacities, especially based on the WISC framework. There are places to where you can conduct screenings and assessments, provide counseling, link students and families to services in the community, coordinate case management for students, provide teacher training to create a positive learning environment for all. and provide the early intervention and prevention services that are anchored in evidence-based strategies as a mitigation strategy for conditions that can intensify and potentially metastasize into mental and physical health crisis. However, I think we realize as districts, right, even as county offices and so on and so forth, there are so many barriers to connecting students to mental health services through schools. For one, sometimes there are a lack of resources, which can be a challenge. There's also a lack of non-Medi-Cal associated agencies that compound these competing agencies between county agencies and community-based providers, and which presents a set of inequities for many of those families who don't have Medi-Cal systems. So for school districts, really the school-based mental health providers and community providers that we work with are really underlined or work under Medi-Cal services, but we have many families who have commercial insurance and hence have to wait a longer period of time to receive services. There's also mental health and social emotional learning in schools. We know that heals the community. When communities see their schools as a sense of support, they feel more confident to send their children to school. For me, I believe it's a truly climate and culture builder that is needed more so in our schools. We learned so much with COVID. COVID has really exacerbated, right, many of the needs that we know that our students and also our staff needs. I think also during this time, we've recognized that we've prioritized the academic needs of students for centuries. But mental health and social emotional learning must be prioritized as well. They must work in tandem. I've heard so many times, and I've stated so many times, students must mask slow before they bloom. The basic needs must be taken care of before students can excel and achieve academically. The report also further communicates the need for more federal funding to fully serve children and youth with health, which includes the mental health, emotional health, and the other WISC components that Dr. Temkin spoke about. Most districts are not in a position to compete for grants. We heard a lot about grants, whether they are, competitive, discretionary, so on and so forth. Many districts are just not in a position to compete for those grants. So that said, there should be money that should just be allocated to districts in order to serve students around these WISC components. Also, when you look at our rural areas, isolated parts of the nation, we need just more funding to help them as well, right? Sometimes they can't compete because they don't have community agencies to help serve students. We also need accountability measures to support our students, right? What targets, what outcomes are we trying to reach? Mental health and overall well-being is zip code indiscriminate. It is impacting just everybody within our nation. And again, we talked about the education and health fields working together, not in silos, better programming of services. Just to talk to you about some things that we're doing in Long Beach, just in essence of time, we are tackling these issues from a tiered intervention response model. For example, from a tier 1 level, we may be working on classroom lessons that focus on social skills and mindfulness. From a tier 2 level, we're working on individual or group sessions for students. And then we're utilizing our tier 3 for our school-based mental health providers and also our concierge services that we use to connect our families who have commercial insurance or maybe Kaiser, right, to many of these agencies as well. Professional development, we know that is needed to work with staff on social emotional learning and trauma-informed practices. Sometimes our staff members don't realize, right, the trauma that our students are facing, right, whether that's within their communities or within their homes. And so with our staff now recognizing that, right, hopefully showing some grace, working with our students within that context, and also providing right academic lessons and other lessons that can support our students within the classroom. We've really worked on having focus groups with our families of color to confront the linguistic, cultural, and social barriers to accessing and using mental health services. Let me tell you, there is still a stigma and misunderstanding around mental health services. So having those deep, intimate conversations with our families has been hugely important in order for us to move into this way as well. We've used telecounseling to assist our parents who just can't get to the school site to help link them to services as well. We utilize our school-based mental health partners as our tier 3, as I discussed. We've hired more social workers to coordinate better referrals to families. And we use our local hospitals by way of mobile clinics to get our students vaccinated, and also to educate and inform our parents around COVID, around the Delta variant, and many other viruses and illnesses that are happening within communities. But going back to the report, just more conversations, more coordinations with health and education agencies are needed. Federal funding is needed, and just deeper conversations around that work and what our school systems need across this nation are definitely needed. Again, thank you for your time. I'm very passionate about this. I can talk about this for hours. I realize I don't have that time, but again, thank you so much for this opportunity.
Thank you all for your reflections on the report at a very high level. It was very helpful to have you frame up the conversation about long-term planning to support healthy schools. So we're going to bring back all 3 of our speakers now. And I just want to continue to encourage those joining us to submit any questions they have in the Ask a Question box on your screen at any point during the forum. So let's start with a couple questions. So, let's start with the positive. What makes you hopeful about the future of school health in the coming 5 to 10 years? We've all reflected on some of the learnings from the pandemic, but what can we take to move forward that will bring us hope and hopefully engage the schools in a more meaningful way in health work? Why don't we start with Holly?
Okay. What a great question. So I will say that throughout the pandemic, one thing on a positive note that has happened is that we at CDC have started to coordinate a lot more closely with the other federal agencies. In fact, we're working very closely with SAMHSA now to think more broadly about emotional and mental health integration with physical health. And the pandemic has forced us to work across federal agencies to support schools in a way that potentially is as helpful as we can be, right? And so I think that is a bright spot. I think it's something that can continue and can more broadly address these priorities that are within the WISP framework. And I think having this report actually gives us one step ahead, because now we know where some streams are, where some opportunities are that we didn't necessarily know before. So we're making those connections already, and I am very hopeful. And I know collaboration is very hard, but I happen to enjoy it very much. So I am very much looking forward to more coordination and collaboration around the WISP framework and addressing emotional and physical health in an interrelated manner.
Thank you. Charlene?
Sure, and you must always have hope. And so I certainly appreciate the question. I also appreciate that you're talking about integrating health into schools versus adding health on. In the education space, there's always vying for time and attention in that space. And I know Erin, I'm sure she can speak to that eloquently about the need to make sure we're able to we can integrate efforts instead of saying, let's add one more thing. Let's try to add on to the workday. You've all talked to the school day. You've all talked about the studies and the fact that health and education are truly linked. Health and achievement are linked. And that is studies that we've now seen. But I can tell you, it was not always easy to have those conversations. They were sometimes relegated to the other thing that comes after we address the academic needs of our students, right? And so now there was a quote that I always like, and I'll use it here, and is that there's no curriculum brilliant enough to compensate for a hungry stomach or a distracted mind, right? There is no curriculum brilliant enough to compensate for a hungry stomach or a distracted mind. And that's a quote I've been using for many, many years, and I see it more now, but it's so important. I believe that, again, one of the impacts of COVID is that folks are really recognizing that this is something we cannot get to the learning if we don't address those foundational and fundamental needs of our students and our staff. And frankly, and the support for families and getting communities engaged in this effort. So the good news and what gives me hope is that there's more and more conversations, and folks are much more open to say, let's have this conversation, let's integrate our structures, meeting with behavioral health providers. And I share this broadly, that is my audacious goal in Connecticut, that every school building, we have over 15,000 of them, that every 1,500 of them, that every school building will have that behavioral, physical health, mental health supports embedded in it, whether it's by hiring staff that can provide that work, or working with behavioral health providers or community-based health centers that can be embedded and staff embedded. And folks are really open. So I'm hopeful that there's this openness to now have this conversation and to collaborate. Folks are much more willing to knock on the door and say, what can we do? So we now have to step back and say, how do we organize ourselves for this level of coordination that is so fundamental and so necessary? It's bringing philanthropy in the room. It's bringing so all the funders and providers together to say, how do we do this? The WISC model is one. You see it on our website because it's something that we've been working on for a while and working with partners in looking to see the connection between school wellness policies and the WISC model and how all of that is integrated. So this report helps us to really bear down even closer. But I am hopeful that because folks, there's much more openness at this point in time to have these conversations and to collaborate. And I call it authentic collaboration. We've seen that, just with the pandemic, our relationship here at the state agency is much stronger with our public health agency, because folks who didn't understand who an epidemiologist was or is, or what that word even meant, now recognize the importance of being able to work together collaboratively. So I call it our best-in-class collaboration with all our state agencies, and we need to be working much more closely to that. And folks are ready for this level of collaboration.
Thank you. And Erin, let me ask, what makes you hopeful?
I think Charlene and Holly just really stated everything eloquently. I think for me as well, I am optimistic. I am optimistic because there's more advocacy around this work. I feel like our legislators are listening and understanding more around the struggles, right, that many of our students and our staff are facing at this time. I think the global pandemic really underscored the need for more services. And it's very interesting, right, when you think about it. These issues have been, right, with many of our students for years, right? Trauma, mental health, we heard about it, things that are happening within our communities, within our students. I think now with mental health, suicide, and many of these other things, right? Food insecurities, housing insecurities, it's hit more swaths of our nation, right? It's hit, folks who, for so many reasons and so many years, maybe didn't have some of these issues. And I think now that we have more voices speaking out around the need for mental health, for physical health, for better nutrition for our students, I think we are making better strides to serve our students and families well. So again, I'm optimistic. I'm hopeful, as Charlene mentioned, that our school staff and teachers won't see this as something else. And so we have to do a good job of integrating that right into our academic curriculum, into our school day, which is something that Long Beach is heavily doing, especially this year. We're using this year as a restorative year because we realize that people are at their breaking points in so many ways. But we also know that we have to include the SEL, the mental health frameworks, the physical health, ensure that our students are well fed in order, right, to get to where they need to be in order for them to thrive, and also for our staff to thrive as well. So again, I'm so appreciative of the report, and I look forward to the work that's bound to come.
Now, the report had some important findings around equity. And so I guess the question for the panel is, what needs to happen to ensure that total health is available and accessible to everyone in school? And are there resources and supports that can be put in place during the pandemic that can continue or what other opportunities are there to address equity in a meaningful way as we look at the federal landscape of funding? Let me start with Erin first, and then go to Charlene and end with Holly, please.
I think simply, and thank you for the question, is to make sure it's for everyone. We know that with equity, that some students, right, are going to need more maybe than others, but to ensure that it's available, right, to serve, right, all students in very meaningful and very intentional ways. And I think when you have a multi-tiered system of support that allows you to recognize, right, which students need more just based on a tiered level. So I think if we're receiving, per se, support and more resources, whether that's monetary support, wherever that may be, even from our federal landscape or federal government, right? How do we do that in a way to where we're very intentional about how that money is being utilized, and also an accountability system as well that ensures that schools and districts are actually incorporating the work as it's needed.
You know, and I'll add to that the importance of understanding where the needs exist. So many times we may think we know, and another quote I try to use is not about them without them. So let's talk to our families. Let's see where those needs exist. Think about what can be supported inside the schoolhouse doors, and what other things we need to think about, as schools still need to be about the business of teaching and learning, and then addressing what those non-academic barriers are. They cannot do this alone. So it really is important that in all the dialogue that we're having, that we're clear. So when we talk about equity, we're talking about what that truly means and not what we think the definition means for us individually, right? Know our communities, know our families, and certainly talking to our school staff and school leaders to make sure they're a part of that. So I can't underscore enough the need to make sure that those conversations are indeed happening. And then you've got to move from talk to action, right? Because this is not about spending the entire time admiring the problems, but also be about solving them. And so it really is important that we have those conversations around families' needs, and take a look at, again, we have this great opportunity with our funding, the funding that's provided to us. And I recognize that there's worry about a cliff that may come at the end of all of the federal resources. I've reframed that here in Connecticut. We talk about a parachute. So you don't get to the edge and you have a cliff, but you get to the edge and there's a parachute for a safe landing. And that parachute for a safe landing is because you now know what works, right? You've done the hard work of making sure you know what the outcomes are for your investments. And so by the time we get there, that we're able to say to our leaders, to our policymakers, through the federal government, these are the things that work. And so we should continue to invest in what works. So to me, the hope is there as well, that we do that. But this focus on equity is important. We need to make sure it's beyond words, and that we do the due diligence of making sure we understand the impact on all our families and all our students and all our educators and what's necessary. Again, I love the concept of making sure that they are resilient and making sure that they can thrive.
In terms of at the federal level, well, one of those low-hanging fruit for us, I think, in terms of prioritizing further, is being more specific in our criteria and our funding announcements and all the grant streams that are available. As noted in the report, I think there were a number of funding streams that would cite perhaps a priority, or that you need to focus on equity, but what that means, you know, in terms of key populations, I don't think there was a lot of specificity based on what Child Trends found in the report around how to address equity through the funding streams. And I think that'll be important moving forward. We have actually, or we will moving forward, because nothing is published yet, but we will be adding criteria into funding announcements moving forward. The key point here, though, is that given that every state is different, every community is different, their needs are different, we truly rely on these communities to identify what populations need more help than others and where they want to put these dollars to be able to address equity and ensure that everybody has equal access or services. So I think we just need to be more explicit in how we do that to make it perhaps easier for potential grantees to identify what they're going to do and what they expect in terms of reach, and what is reasonable in terms of key populations that need more assistance.
So several of you have talked a little bit about the need to better engage community and parents in particular in decision-making moving forward. And I'm wondering if some of you can talk a little bit about some best practices or tools that you've used to get the community perspective more tightly integrated into the planning work that you've been doing.
Well, I can speak to in California, we are, mandated through our local control accountability plans to engage our communities, our parents, our families, community agencies, right, in our process as we're spending this money. And so for us, we've had some conversations, right, around programming, services we should be providing, and even agencies, right, that may be able to best help us, right, with our efforts. I think also just from a separate standpoint, outside of the LCAP process, my team utilizes the voices of not just parents and community members and staff members, but also students, right? The voices of our students are very powerful. They are very candid, especially when they trust you in the process, and very open and very transparent about telling you their needs, right? Some challenges they have, and how the school district from their vantage point can help them move forward and be successful. And so that's something that we've probably utilized within my office, probably more so than than parents and community members, are just the voices of our students and them recognizing, yes, we do need some help, we do need support, but we also need our staff and maybe others to understand this is the perspective that we're coming from and why we need, such support. Or, I don't appreciate when they kind of pigeonhole us into this one box without understanding what our needs are. So that has been very beneficial, right, in our efforts moving forward. And based on that, we've been able to provide more resources and services, right, that they have utilized, and just some more support systems within our school district as well. So student voices, most importantly, parent and community voices, guardians' voices as well are much needed when you work through this process.
And I'll add to that the need for authentic engagement, that this is not an exercise where you check the box and you move on to the next space, that you have systems in place for that to happen in an authentic way. And I'd give one example. So best practice, several years ago in Connecticut, we developed the Commissioners Roundtable for Family and Community Engagement in Education. And this occurred because we recognized you could always get to the organized group for superintendents or the organization for principals or educators or unions. And I remember asking the question, but what if we want to hear family and community voice? So where do you go for that? And so we put together a diverse group. We now meet every few months. And it's not about telling them what we're doing. It really is about giving voice and agency, right? It's hearing about what their thoughts are about the things that we're doing. They assisted us in developing Connecticut's definition and framework for what is family engagement, which talks about equity and talks about authentic communication and dialogue. So I would say that really is important to establish those, and folks need to recognize that their voices do have power, and folks are really listening and paying attention to the things that we're hearing. And so we've established that here, and so that I would say is an exemplary practice. The same is true for students, making sure there's a way we've had thought exchanges, hearing from students, what do they think about particular issues, so we can build that into our planning moving forward. So same is true, I think, at the federal level, same is true at the state level, and I hope we're modeling for districts what it is that authentic engagement needs to look like. The American Rescue Plan ESSER application required that not only at the state level that we do stakeholder engagement and make that a part of our plan process, but that the districts do the same as well in developing their plan and making sure they're posted. And so that's an opportunity that as we think about it, certainly we'll take a look to see how that worked, but really important that those voices are there. And we're helping to, again, we're getting ready to launch, to release our assessment data. And we're talking about what is the one pager for families, or what is the one pager for community, right? So you're constantly thinking about how do you reach our multiple stakeholders and audiences in a way that they can engage with the information that we're providing, so that they can be involved in the decision-making process and sharing information that will inform how we move forward.
So one of the, go ahead, sorry.
No, go right ahead.
Okay. So one of the core strategies that we've asked folks to consider, first at the state level, then district, and then school level, is the creation of coalitions at the state level that represent all the key organizations, might be the National PTA, the business organization, faith-based organization, and the same for the district. What we refer to as the district school council would be representative of all those components within the WISC model. So you would have your counselors, your psychologists, your health educators, your food service personnel, your social worker, parents. And then at the school level, the same kind of approach in having a school team, because again, having that community representation, doing the planning, and we have tools. There are lots of tools that teams and councils can use that are guides for adopting the WISC model, getting started, looking at their policies and practices. So we encourage that as a first step. And we've learned from our grantees over the years that, leveraging, I think, Charlene, you mentioned earlier, the local wellness policies. There are often local wellness policy councils. Some expand on that, and address broader health issues. But that's a real nice lever, the local wellness policy requirement, to really think about, okay, so where are our strengths? Where are our weaknesses? How can we, strengthen the community support? The one thing about, I just want to make this point here, is that when we developed the WISC model with all this input from, key experts at the district, state, national level, et cetera, the reason that you have community engagement as a component within the model, but notice that the WISC model itself is framed within the community. The community surrounds the entire model, right? And the reason that is that way is there's no greater component to actual adopting healthy school environments than having that community buy-in, and that the school is very much a part of the community.
And Cece, can I just jump in for a minute just to add to that? Like Erin, this is a topic of much interest and passion of mine. And so to Holly's point, so whatever we can do, whether the state, whether the federal, to leverage, so if the model is there and we're saying this is what, for a grant, for example, and if you need to put together a collaborative, to say, if you have this school wellness, wellness group or council, to utilize that. So we're not asking us at the state or the district to start to develop these individual groups, right, to leverage an application. That's a great way of aligning our efforts. So it makes it easier for a district to say, I'm going to apply for this because I don't have to try to, develop all these additional structures. That alignment, I think, is really, really helpful.
Thank you. I want to move us along. We've received a few questions from our audience. So I will start with this question. For any of the speakers, what do you think is the key to sustainable federal interagency coordination and collaboration, including work that can survive a change in administration?
Well, that's quite the loaded question.
Yeah. Yes.
Hmm.
What thoughts?
Well, I'll go ahead and provide an initial reaction, having been through multiple administrations and various collaborations over the year. I think it's relationships. I think it's long-term federal employees that build relationships. They're passionate, like Charlene and Erin, and they will keep working through they will work together to keep working through the various changes that occur through changes in administration, because it's going to happen. And you can't think about things long term if you don't think about the fact that certain things may change. You got to be adaptable. But I think relationships really are critical.
You know, I'll add to that, and with that, Holly, is trust, right? So we're talking about trust in relationships that can survive. And, you know, John P. Carter, Harvard, talked about leading change, and he talked about the 8 stages of change. And one of them is making sure you embed the change within the culture of the organization. And so I would say you continue to do that work, whatever your organization is, but you embed it. It has to be able to survive you. It has to be able to survive that charismatic leader, right? And so the hard work of getting a guiding coalition and making sure you embed those changes within the organizational structure and fabric, and the relationships and the trust that you build can help to survive, frankly, those changes that may occur in that space. And we don't have time today, but I can give you examples of how that, I've seen that work even within our own organization here, that we've got work or work in discipline or work in attendance is now 10 years and counting, and we're getting really, you know, good results. But because it survived, you know, some leadership changes, and there's a way to do that, and a conversation that we can continue to have about how to make that happen.
And I'll just add just quickly, just 20 seconds, truly have people understand the importance of that work. And once they understand the importance of that work, as I believe Charlene just alluded to, right, no matter who leaves, who takes over in a new spot, people understand that importance. And as time goes on, things are going to morph, things are going to change, just based on new needs of students, but also knowing that that work is there, it's going to expand, it's going to change, it's going to morph, but the need for, right, whatever it may be, is going to continue in some form and way.
Thank you. Another question. How should schools and government agencies utilize findings from the 2020 census to drive resources into school health initiatives? Your thoughts?
You know, I'd probably say that you use it the same way we're really working to be data informed, right? So it's yet another set of data points that I would add to other data points that you're looking at for decision making. And again, making it a conversation that you're having, right, with key partners in the room. But clearly that it's the census data, it's our assessment data, it's other community data, you know, based on where you are in the context that you bring in, so that we truly are using that to inform the decisions that are being made. And that also builds the trust and the relationships as well, that you're not in isolation trying to make change because you think something needs to happen, but you're truly being informed by information that you can gather.
And I would say, ditto, Charlene, let your data tell the story, right? With the census data, our census data, I know, has definitely told a story for us. It's told the story based on some things that we're doing and some things that we need to add, and sharing and discussing that data alongside other data points that are essential as well, really helps us solidify and also advocate and move forward with decisions that we make as a district, as a community. And so it is essential in order for us to, right, make our point, let our data tell our story, and add different resources and supports as needed based on the story of that data as well.
So let me turn to our final question, and I want to thank the audience for submitting their questions as well. And we didn't get a chance to get to all of them, but thank you. So if there's one thing that you hope people remember about this discussion about school health and the future, what would that be? Could you share that with us, please? We can start with Holly.
I think just listening to what everyone has said today about the importance of collaboration, sustainability, and trust. I think that if we really look at what the report says and the implications for our work, and think about also state and district level policies, because we can only do so much at the federal level, and make some change for the good. I'm hoping folks will walk away inspired to say, look at all these funding streams, and we need to work together to build our teams, our councils, or build on whatever we have, so that we can provide a more comprehensive, holistic environment for both our students and staff.
And I would add to what Holly said is that we need to work together. And those are not just hashtag, let's work together. It really means roll up your sleeves. It means maybe working through some discomfort. It means seeking first to understand and then to be understood. Because as we look at the report, we can say, oh my goodness, those feds don't have it together, right? They're not organized, they're not aligned. We could say the same thing at a state level. We could say the same thing at a local level. So we need to really just get in that space together, recognize that with challenges comes opportunities, and we have this opportunity. And the other thing is that we all need to coalesce. I like to think about putting our students in the middle of the room, or visually thinking that's where they are, right? And we all must find the common ground in what's in their best interest. And so that is my hope, that we would continue to do that. There are challenges, but yet there are opportunities. Let's listen to each other. Let's work together in an authentic and a real way on behalf of our kids and families.
Quickly, collaboration, equals sustainability, right? Sustainability to, continue with the work, again, to change as the times kind of force us to do, but also student agency, student voice, and how important that is. Listening to your students, listening to your communities, listening to your parents, reviewing your data, right? Don't just make arbitrary decisions just based on what you think is happening. Work with your community and have those hard conversations in order to make impactful and effective change. I am so optimistic, and I try to always be optimistic, right, about the work, but also a realistic in knowing that we're going to have to do more. We're going to have to do more to work together. We're going to have to do more to break away from our silos. We're going to have to do more to collaborate. And I know that time is a huge issue for many of us, especially stepping into a new academic year. But we have to work together in order to get this right for our students, our families, and our staff. They are counting on it.
Thank you. So to all of our esteemed panelists, I want to thank you for sharing your time and insight with us. I thoroughly enjoyed our conversation today. Now it's time for our final audience question. So to participate in the poll, if you haven't already, please register by texting Health Policy 261 to 22333 or by visiting pollev.com/Health Policy 261. So our third question will be based on the panel discussion. What is one key takeaway or action you can take to support healthy schools? Based on the panel discussion, what is one key takeaway or action you can take to support healthy schools? Let's see. How can schools and districts also work with community-based organizations that have existing trust and relationships with students and families? Collaborate. Great. Are there responses? Better understand avenues for funding at state and federal levels. Yes. Work to break down silos. We're all working toward the same goal. Use data. Excellent. Well, wonderful. Thank you. Support teachers. I think if I was answering the poll, the other thing I would add is connect with students and families as well. We heard that from a few of our speakers. Seek collaboration with health organizations, data, cultural humility, engage school stakeholders, including students. Excellent. Find common ground through data and dialogue and take action together to encourage and participate in the improvement process. Broaden the conversation about how school health encompasses the whole child and school community. It's not about them without them. Of that. Include support staff and efforts. They live in community. Listen. Wonderful. So please feel free to continue to respond to the poll. And thank you to those of you who are participating. We'll post a recording of the event on our website in the coming weeks, and you'll also receive a survey following this meeting requesting your feedback. Thank you for joining us today. Now I will turn it over to Annie Reed, Kaiser Permanente's leader of our Thriving Schools program, to close us out for the day. Annie?
Great. Thank you so much, Ceci. And a huge and incredible thanks to Holly, Charlene, and Erin. You guys, your passion is infectious. And I just want to say thank you for your leadership, for your innovation, and for the way that you're supporting your school communities and really helping us lead the conversation nationally about how we better integrate, as Charlene said, not add on, integrate health in schools. So this has been an incredible discussion, and I wish that we had more time for it. So watch out, because we'll probably invite you to do this again. I just want to comment before I close out on a few sort of key themes that have really resonated with me during the discussion. First, and Ceci, I think you just called this out, is really centering our systems to meet the needs of our communities with input from those communities. And I think one thing that really stuck out for me is that oftentimes when we think about health in schools, we really are talking about students. And of course, that's an enormously important focus. But what really came front and center today for me, and something that we really focus on at Kaiser Permanente and specifically in Thriving Schools, is the importance of addressing the needs, the health needs of school staff and teachers, to make sure, to use sort of the old saying that we're putting the oxygen mask on first and really able to attend to the needs of the adults in the building, and ensure that they're able to do their jobs and be satisfied and content, and also have the ability to support the students. The second piece for me was really around, the equity question. And I think this is importantly becoming more and more of a focus of our work in school health. And that is, I think that healthy schools really is fundamentally about equity. And I think that this conversation sort of reinforced that for me. We cannot address the academic disparities that disproportionately impact communities of color and low-income communities without addressing social, mental, physical, emotional needs, both as a prerequisite and sort of parallel with the academics. So really thinking about how this is a response to a call for increased focus on equity. I also think, and this didn't sort of come up as something that somebody said, but it just kept resonating for me as this panel was talking, and also as Dr. Temkin was making her comments about the report. Is really this question about how we brand or define this work around school health. I think sometimes we think school health and we think very narrowly about health services or health education. But what we're talking about, and sort of what the WISC model I think really implies here, is that we are talking about a very broad and fundamental sort of definition of expansive definition, I would say, about how we think about health, that includes the social needs, that includes emotional needs, and that we are really rethinking health as a critical input for education, because frankly, we're all headed toward the same horizon, right? Whether we're in healthcare, whether we're in education, whether we're a counselor, whether we're a school nurse or a teacher, we're all driving towards the same outcomes. And so thinking about how to rebrand our work to really encompass a broader definition of health in schools. And then I think sort of similarly is that what we learned today is that the existing structures and systems, and I think a lot of us know this really sort of fundamentally, is that our existing structures and systems, they're not working to support that more integrated vision of the WISC model. And so how can we, I think, really re-envision a future where those systems are designed around the needs of our communities, rather than us trying to make the systems work to meet the needs of our communities. So it's a little bit of a nuance, but I think that that is sort of an important piece of this, is that we're really thinking about how to reconsider our systems, especially in this unique moment. And then finally, a huge theme that came across was this idea of breaking down the silos and this need for collaboration across our sectors, including across health and education, across agencies, as Holly really mentioned in her opening remarks, across the dimensions of health. So not thinking about, physical health is separate from mental health, is separate from social health, but really thinking about them as a total health or comprehensive, which again, I think is really embodied in the WISC model, but that we can't address one dimension of health without thinking about the other. Also, collaboration between schools and community I think was a huge theme that came across in the panelists' comments. And I think then also collaboration between all of us who have joined today. I loved seeing the word cloud at the beginning, representing sort of the diversity of roles that are joining this call, because there are so many stakeholders for whom this conversation is really important. And I gotta say, I think we have an opportunity to work together better, so that we're really aligning on what a shared horizon and vision for our work is, so that we can make some of the changes that Deb and the panel really elucidated for us today. So with that, I will say, and I'm going to get a little preachy here, but I think we have an incredibly unique opportunity to transform how we conceptualize schools. I mean, silver lining of a pandemic is that I think we know, and actually many of you probably heard, there was a Dr. Ann Zink, who's the chief health officer in Alaska, made a comment that, we have learned in this pandemic that people don't necessarily know who their state chief health officer is. They definitely, may not know who their local health officer is, but guess what? They know who their principal is, and they know who their teachers are, and schools are public health. We have learned through this that was what she said verbatim. I will never forget this. Schools are public health. And I think this is such a unique moment to really think about health as a foundational, non-negotiable part of what schools are, how they operate, what they need to be successful, and how to structure our systems around that vision, again, rather than letting our systems dictate how we support our students and school staff. And I think the opposite is true as well, that we really think about how education can be integrated in healthcare too. So putting the onus down for all of us. So as Ceci mentioned at the beginning, Kaiser Permanente convened and continues to lead the National School Health Collaborative. We are working to seize that opportunity to develop a bold, ambitious and action-oriented policy agenda for the next decade to help us achieve that vision, which is fundamentally to coordinate and accelerate equitable funding, policy, and practices to advance the health and learning connection so that every school succeeds, every educator excels, and every child thrives. So while we have this group of about 10 organizations they're really working to develop a draft of the roadmap. When I think about who's on this call today, we need each and every one of you to both provide input on that roadmap and also to help activate the roadmap, because wherever you sit, we're all going to be important, critical collaborators to drive towards this horizon. So we will be in touch. That is my commitment to you. We have your email addresses. You will hear from us to get input and feedback from you and to help us activate on this roadmap, this 10-year roadmap for healthy schools that we're developing as part of the National School Health Collaborative. So I'll close by saying thank you again to all of our incredible speakers today and to all of you for making time to listen in and participate. And a special thanks to the Institute for Health Policy, especially Renee Gross, who's been behind the scenes, and Cecilia Oregón. Of course, you've been incredible. Thanks for organizing this timely and thought-provoking event. And I look forward to all of us locking arms to create healthier schools for all. Have a great day, everyone.